Welcome to The Backstory, a podcast from the North Dakota News Cooperative that takes an in-depth look at the stories we're reporting for you. I'm Sabrina Halverson, CEO of the North Dakota News Cooperative. Joining me is Michael Standaert, our lead reporter. Okay, so Michael, we're going to talk today about one of your latest stories, and this has to do with the measles outbreak, and it has finally hit North Dakota. The headline for this story is North Dakota reports first 4 measles cases amid declining vaccination rates. And I thought this was such an interesting story, and I really wanted to chat about it on the podcast because I thought this was a good opportunity to really tell our listeners about what we do as journalists and for bringing information to them. Because when you first submitted this story, we did not have any measles cases in North Dakota. And you and I had been talking that day, and then you sent the story out to our newspaper partners. And at that time, the headline was, or
Yeah, potential
paraphrasing
measles
here,
case, yeah,
yeah.
potential measles cases could cause overwhelm in the system here.
And then
Yeah,
within
yeah,
hours, you got this. I got an email from you saying, "Hey, this has changed. I'm resending out the story." So tell me a
yeah.
little bit about that.
Yeah, I had been following for several weeks. I mean, there's been this measles outbreak originally in Texas. It spread to other states. Texas still has the majority of cases, but it started to spread to nearby states. So Montana and Minnesota had started to pick up some cases. So I thought it was good timing to get something out on North Dakota's preparation for this and looking at some of the declining vaccination rates. I thought it was timely to get out to people so they know kind of what the situation is. I had finished that story on Friday, and then all of a sudden one case gets confirmed that evening, I think around 7 p.m. We quickly changed up the story and got that out and notified the newspapers that the cases had arrived. Yeah, and then ever since, there's been more cases reported by the health authorities here. I guess the latest as of today, there's 9 confirmed measles cases in Williams County, and at least 4 of those were in the Williston school system while they were infectious. So that's a concern going forward. I know there's been another report now in the last day or two that about 180 students in the area are isolating at home
Yeah.
because they've been notified by public health officials of exposure at those campuses, those 3 campuses. And this is such an infectious disease. Every official health pediatrician or health official I spoke with said this is pretty much the most infectious disease that they deal with. And North Dakota hadn't had a case since 2011. And at that time, vaccination rates were a lot higher than they are now. I think 2019 was the highest ever at about 95%. And that's where you want to be to create what they call herd immunity or to reduce community spread.
Yeah. What I really want to highlight with this story again is I was just so happy when you emailed me, obviously not happy to see that measles had arrived in North Dakota, but to see how much you were staying on top of the story. And for our listeners and our supporters at North Dakota News Cooperative who aren't journalists like we are, who haven't spent their careers dedicated to this, what is the importance in staying on top of a story like that?
Yeah, for many stories, you don't really have to do that. But for one like this, when things can change very quickly, you just have to keep paying attention to see what's going on. We haven't followed up with any stories since then. We've been updating the website to let people know of the new rates and what's going on. But it was important to change that at that time. You don't want to put out a story that said that there's no cases when all of a sudden there's one case. Yeah, if you know that happens, if it was good that one of my sources was also keeping me in the loop because even the communications people at the government who release statements, they might just send it to your email and you might not be checking your email all the times. But this person reached out directly and I was able to get things changed and let the papers know, hey, there's a case. And some of those papers, I think, went and did some of their own quick stories based off the health authority, the Department of Health and Human Services statement, and then ran our story later, which has a lot more background about vaccination rates and the declining vaccination rates. Some of the opt-outs, more and more people have opted out in the last few years of having their their kids vaccinated and are giving reasons as personal beliefs and religious beliefs. And so it's a different situation than pre-pandemic when, most people were getting their kids vaccinated to a pretty high rate.
And so that's what we do here, or that is what we do here at the North Dakota News Cooperative, where we are not breaking news. We're not a breaking news agency. We go in depth on stories and then do that type of reporting. You go out there and really go deep into the stories because a lot of our newspaper partners don't have the resources to do that. Again, another good example in this measles story, it's twofold. You take a look at the measles that are here in North Dakota, but then also you go deeper into the subject and look at vaccination rates and vaccination hesitancy and that kind of thing as well. So I'm curious, as you were working on this and as you were reporting on this, was there anything that you were surprised to learn?
I wasn't too surprised that the vaccination rates had declined. One of the surprising things was that in certain counties it's very low. I can't remember off the top of my head, but in Williams County, just where the current outbreak is right now, let me see if I can find that rate. So only 81% of kindergarten age kids in Williams County are vaccinated, which is it's about 9% below the state rate. The more kids that are unvaccinated, the more chance there is to spread it within the community. And then if you go just one county south to McKenzie County, it's 70%. And if you go another county south to Billings County, it's 67%. So there are some areas that are having very high vaccination rates for kindergartners. In a couple of counties, it was about 100%. And then other ones that have dropped off considerably. And some of these counties may not even have that many children. Yeah, if they're not vaccinated and not up to the around the 95% level, then it just means that more spread is likely to occur in those areas.
Yeah, so that's probably could be one of the reasons why we're seeing it more in Williams County now because of that lower vaccination rate.
Yeah, and I think one area to watch would be Watford City, considering their rates are pretty low, it seems. And the northeast part of the state seems pretty well covered. Pockets in the state are also well covered, but it seemed like the western half, is particularly up in Williams County and McKenzie County there had less coverage.
Yeah. And as you said, because of the outbreak in that area there, they are now asking unvaccinated students to stay home and quarantine because there is a risk of this spreading even more. When you spoke with the authorities, your sources for this story, were they concerned of a wider outbreak?
Yeah, I think there's a big concern of a wider outbreak is it's the most infectious disease that they have to deal with. And they said if you come into contact with somebody that has it and you are unvaccinated, you have a 90% chance of getting measles yourself. It's very easy to spread. It stays around in rooms for a couple hours. One issue is with clinics that might see an influx of cases where kids are just showing up sick and they're not displaying the rash that you see with measles yet, because that takes several days to display itself. There's a chance you have people rushing into these clinics with kids that are coughing or have a runny nose and want to be checked out. They could unintentionally be spreading measles in that clinic. Another area of concern is that there's not a lot of negative pressure rooms in areas around the state. Some of the hospitals have a good number of these rooms, which you can take an individual who's displaying or is pretty to being identified as having measles, and you isolate them in that room so they're not in contact with other patients. If a clinic has one person or a couple people come in, it would take they would have to clear the room, take 2 hours to clean that room, or take 2 hours before they can go back in and clean that room to disinfect it. It's a very contagious disease, and I think there's concern. The one positive about North Dakota is you don't have as many people as there are in a place like Texas, so that could potentially reduce the amount of spread there is.
You also wrote about vaccine skepticism. And in your research for that, was there any indication as to why that's growing?
Yeah, and I didn't go too much into that part because I think some of that is already discussed out there in the public and people can find out that on their own. It's generally grown since the COVID pandemic with all the different controversies over getting the COVID vaccine and this sort of thing. And there's been a lot more vaccine skepticism spread in general. And then you have prominent voices
Yeah.
raising concerns about vaccines without also saying that for something like measles, this prevents measles. This has been shown to prevent measles for years and years. The people I spoke with about the vaccines, no vaccine is 100% effective. There's always concerns about some adverse reaction to vaccines, but it's a 1 in a million chance. And if you get measles, you are potentially going to have a life-threatening illness. You're going to be hospitalized. One pediatrician was talking about how when measles was widespread, you'd have cases of blindness and deafness and other impacts from contracting the disease. So if you're doing a risk-benefit analysis, the risk of some adverse reaction to a vaccine is much less than your risk of having a severe illness from getting the measles disease.
Right. And measles also can be deadly as well.
And deadly, yes.
All right. So again, I just want to go back to, I think that this was just such a good example of the importance of journalism and in what we do with keeping communities updated on what's happening, and just how quickly you responded from us going with a story that says, hey, we don't have any measles here, but this could happen, to instantly being on top of it and changing it as soon as that story came out. Yes, we do now have measles here in North Dakota. So good work on that, Michael.
Yeah, we went from not being a breaking news
Yeah.
outlet to being a breaking news outlet. That'll happen sometimes.
That story again with the headline, North Dakota reports first 4 measles cases amid declining vaccination rates. You can read that story on our website at newscoopnd.org or in one of our local newspaper partners. For the North Dakota News Cooperative, I'm Sabrina Halverson. This has been The Backstory.